Well, here we are with Dr. Riopelle again. Dr. Riopelle, dermatologist and doing liposuction. My question here to Dr. Riopelle today is liposuction still the top of the line, or are there many other treatments out there? Because I have heard of many other ways of, so to say, replacing liposuction on television as an ad. Shed some light on it, please.
Right. Well, I would say that liposuction, especially done with the modern technology, the laser and the vaser, is the gold standard for treating fat, to reduce fat in localized areas. It is true there are other treatments out there. Some work, some don't, but I still consider liposuction, specifically laser or vaser liposuction, to be the gold standard. Now, the other treatments do work. We did studies ourselves. We're one of the major test sites for Zeltiq. Zeltiq works, but it's a little unpredictable, and it's not going to take out as much fat by any means as liposuction does. We also have zerona in our office. Again, same thing. Zerona works very effectively to reduce the fat some, but it's not going to take out as much, nor is it as predictable at removing fat as the vaser, or in our case, what we have is the Smart Lipo Ultra liposuction.
Okay. What's that other one you mentioned, that zerona? How does that work? Tell me.
Yes, zerona is a completely painless laser. The laser, one just lies down in front of the laser. We focus the laser beams on the area of fat we want to remove, for example, the abdomen or the sides. And the laser beam goes right through the skin into the fat, and it squeezes or squishes the fat cells, milking the fat out of the tissue. Then we use another process called dermasonic to push the fat into the lymphatics, and it's carried away to be metabolized and used up by the body. And so, as I say, this is quite effective at removing small amounts of fat. So if someone is not particularly overweight, if someone just has a small area to remove, it's quite effective. If it's a larger area, larger localized area of fat reduction that one needs, then the Smart Lipo Ultra is much more predictable, and I think a better treatment for that type of a patient. So it depends on the patient.
I got it. So if a person does a liposuction, which we're talking about here, because he has a larger amount to remove. Number one, can you tell us what larger means? I mean, and in which body parts are really good to do it? Can you tell us?
Right. Well, I would say larger means maybe if you pinch the area, if it's more than 3/4 of an inch to an inch, then that patient is much more of a candidate and will do much better with one of the liposuction techniques. Now, the liposuction can be done on many areas of the body, almost every area. So we do the arms, we do the thighs, the abdomen, inner and outer thighs, the calves, the hips, the back. In some patients, we do practically all those areas, it seems, because some patients have fat in multiple areas. Other patients just have fat in one area, and they would just work that area. The zerona and the Zeltiq, on the other hand, those are good for, as I say, if it's under 3/4 of an inch pinch, that area is going to be a good area that might be treated by the zerona or by Zeltiq. But if it's more than that, I tend to recommend patients that they go with liposuction. Liposuction nowadays is a very safe procedure. It's done in the office. It's done just under local anesthesia. It's a fairly painless procedure to do. One goes home, walks right out of the office, and goes home after the procedure and feels fine and normal. So it's not the big deal that it was in years ago. We do it awake in all cases. Now, liposuction can be done asleep, but it's a completely different animal asleep. Much higher risk, and I think in my experience, the results are, having seen patients who have been done asleep, the results are not as good when it's done asleep as they are when it's done awake.
Got it. Now, if a person doesn't change his lifestyle, mainly eating and no exercise, which probably not necessarily maybe all the time, contribute to having a little more on it. At least my wife keeps telling me that, my little belly comes from not exercising and from eating at night at 10 o'clock. Now, let's assume, because if we would easy change, we might not have it. So let's assume we don't change our lifestyle too much, which I'm sure this is in most cases the case. What do you think? How long does this last is my question. When does the person have to do it again and again? Like there's this stigma out there that with, what do you call that, face things, Botox things that, after a while you have to do it every day. I'm exaggerating, but you get my point. Give me an answer to that stuff.
Well, liposuction, if one maintains the same weight, is fairly permanent. So remember, liposuction is not a weight loss procedure, though. So although we're taking out fat, we're not really making people lose weight, because your weight is determined by your metabolism, your exercise, and your eating, and that balance. And liposuction doesn't affect that balance. Liposuction is a contouring procedure, so it's a sculpting procedure. It's something that makes the body look nice. And when we remove that fat is gone from that area, and it's not coming back unless you gain weight. So it is permanent that fat is lost. And again, when we do liposuction, we're looking at someone weighing about the same in the long term, because their eating and exercise determine that in their metabolism. But they will maintain, for example, if we remove the fat from the belly area, they'll maintain that weight loss in that area unless they gain a lot of weight. And if they do gain weight, then they're going to gain some back. They'll probably not gain as much back as they had originally, because once we remove those cells from the body, they're gone for good in that area, and it's only the remaining cells that can gain weight there. So if somebody gains weight, they're more likely to gain it in other areas that have not had the liposuction done.
Okay, well, that's good. So that's good news, right? I mean, you do it, and apparently it has improved quite nicely over the last years of how to do it and the workability of it, and then it's done. And the body looks better.
That's right. And with the new technology that we have, the smart lipo, which is a laser to melt the fat, and the vaser, which is ultrasonic liposuction, we can contour very nicely, and we can get out quite a bit more fat than we could years ago. Now, these technologies are fairly new, and a patient of mine comes to mind that I did fairly recently. We did her liposuction with the older techniques before these new technologies came out about just 5 years ago. And she came back in, and we had removed as much fat at that time as we possibly could with the form of liposuction we had then, but she still had a little more than she'd like in the belly area. And the reason that you could only remove so much is that when you were working the fat mechanically back and forth in the old days, meaning 5 years ago, it was all physical, and you couldn't just melt the fat and take it out. Now we can melt the fat. So when she came back asking for a little more out, here 5 years later, we were able to use the vaser and the smart lipo laser on her, and we were actually able to reduce her down probably another 50% from what she was able to be reduced down with the old technology from before. So quite exciting.
Wow, well, that's interesting news. So basically, people who had a liposuction 5, 6, 7, 8 years ago, and let's say they were happy, semi-happy, whatever it might have been. The fact is, with the new technology, they can improve it drastically again.
Yes, right, exactly, even further. Because there was a limit on what you could remove before.
Absolutely wonderful. So people should know that. So if you had a liposuction and if you were basically happy, but you kind of go, wow, it would be nice to take out a little more, that now is most likely possible.
That's right. The other thing we do a lot of with the new technology is tweaking areas. Again, in the years before the liposuction, the smart lipo ultra came out, the technology not being as good, there could be more of a tendency for little irregularities. Many people from the old days had the little lumps and bumps in the area that have the liposuction done. We see patients coming in from doctors that had it maybe even 10 years ago, and they've just got a bump or two in an area, and we can now actually just tweak that area by numbing it up, just this big an area, for example, numb that area, use the smart lipo to melt the fat in that area and contour just that area to get rid of that bump and smooth out the area. For example, one particular area that was really prone to that in the old days was the outer thighs. People could kind of be like this, look fairly ripply, and we can just take that out beautifully nowadays.
Absolutely wonderful. Well, thanks for telling us, Dr. Riopelle.
You're welcome.